Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order, and this is quite easy for the continuous study. I hope you will make use of it. We have given the topic wise videos in the playlist. You can go through it for your better understanding, and you will also not going to miss any videos in between, because in the playlist we have provided it in a very systematic fashion, orderly fashion. Anyway, we have been discussing about the coagulation cascade. In the last class we have seen the coagulation profile. So what are the things that you have to investigate in case of coagulation profile? First thing is we have to identify the intrinsic and extrinsic pathway disorder, and for the extrinsic pathway we have to go for prothrombin time, and for the intrinsic pathway we have to go for activated partial thromboplastin time. Now, although we have seen all these pathways, intrinsic and extrinsic pathway, so let us discuss the intrinsic and extrinsic pathway in detail, so that there is no any confusion in between. Now, what is the meaning of intrinsic pathway? Intrinsic pathway, yes, and how it will go into activate. Now, intrinsic pathway will go into activate when there is injury to the blood vessel. In the blood vessel, when there is a gap in the endothelial membrane is get broken, so blood will touch a non-endothelial surface in between when it is flowing, and that time the process of coagulation starts. As soon as there is an injury, there is activation of clotting factor number 12. Already we have discussed. You can go through this picture. So first there is activation of we are talking about intrinsic pathway. First there is activation of factor number 12, and after this there is activation of this particular activated factor number 12. Now we are going to activate another factor, that is factor number 11. Now what happens after 11? So after activation of factor number 11, this will now activate the factor number 9. Okay, so factor number 9 is also activated. Now factor number 9 now utilizes the help of the factor number 8. So this is the point here. Factor number 9 is activated, but for the proper activation of the proper number 9, factor number 9, we also require a factor number 8. Factor number 8 is nothing but a hemophilic factor. Okay, now this factor number 8 also take help of another important factor, which is actually not mentioned in the clotting factor list, that is called von Willebrand factor. Von Willebrand factor is basically called as factor number 8 stabilizing factor. Basically factor number 9 want factor number 8 to undergo stabilization. Okay, and now factor number 8 itself need a factor to get stabilized, that is called as von Willebrand factor. Anyway, once the factor number 9 is get activated, then there is activation of factor number 10. But important is, for the activation of the factor number 10, okay, factor number 10, we need calcium. We require calcium. Okay, calcium is also called as factor number 4. So I can say for the activation of factor number 10 from factor number 9 also requires a factor called as must require a factor called as factor number 4, which is nothing but calcium. Okay, calcium. So now factor number 10 will be convert the once, and the factor number 9 activate. Once the factor number 9 is get activated, then it activates the factor number 10. Okay, for this particular activation, activation, there is a requirement of the calcium and also factor number 5. So now once the factor number 10 is get activated, it leads to the formation of a prothrombin. it leads to the formation of prothrombin. Okay, so now factor number 10 will convert this prothrombin into thrombin. 10 is a common factor. If from the extrinsic pathway also the things will come to the 10, from the intrinsic pathway also things will come and get settled at 10. From the 10 there is formation of prothrombin. Prothrombin is now get converted into thrombin by the help of factor number 10. Okay, so prothrombin time is very important for extrinsic pathway and also for the intrinsic pathway, because it is a factor number 10 which converts this prothrombin into thrombin. For where is a prothrombin? Prothrombin is there in the blood. Okay, so that will be converted into thrombin by means of factor number 10, but it also requires a calcium. This step also requires calcium. Factor number 9 converting into 10, that also requires calcium. 10 converting prothrombin into thrombin, that also requires calcium. Okay, so now this thrombin which is formed, so that will convert the fibrinogen into fibrinogen. Fibrinogen is insoluble, water insoluble, and water soluble, and this fibrin is water insoluble. Okay, so now, so basically what is that? Prothrombin converted into thrombin, thrombin converts fibrinogen into fibrin, finish. Okay, but to stimulate or to activate this conversion of prothrombin into thrombin, we need the help of all these clotting factors. Factor number 12 activating factor number 11, 11 activating factor number 9, 9 activating 8, 8 requires a stabilizing factor. Okay, 9 further activating factor number 10, and once the factor number 10 is activated, it will convert the prothrombin into thrombin. Thrombin will be further converted into thrombin converts this fibrinogen into fibrin. This is the intrinsic pathway. Now what is extrinsic pathway? When you talk about extrinsic pathway is activated after the injury or a damage. So there is a release of tissue factor. Now talking about extrinsic pathway also begins when there is an injury to the vessel. Okay, now as soon as there is injury to the vessel, endothelial surface, there is release of some of the tissue factor. Okay, there is some of the tissue factor. These tissue factors are nothing but some of the membrane phospholipids. These membrane phospholipids, which are named as tissue factors, so they will going to activate the factor number 7. If you look into the picture, so after the injury, there is some of the tissue factors that is membrane phospholipids are released, and they will going to activate the factor number 7. Now once the factor number 7 is activated, so that will convert, the 7 will be converting or activating directly the factor number 10. Once the factor number 10 is activated, it converts prothrombin into thrombin. Okay, so this causes the further activation along with the intrinsic pathway. So once the factor number 10 is activated, now it merges with the intrinsic pathway. The both are merges. Afterwards, once the prothrombin is formed, once the prothrombin is converted to thrombin, then it is a common pathway for both intrinsic and extrinsic pathway. Okay, once the prothrombin is converted to thrombin, thrombin now converts fibrinogen into fibrin, and fibrin meshes are formed. Okay, so now, so whatever is the pathway, ultimately the factor number 10 is activated. That is very important, factor number 10, and this converts the prothrombin into thrombin. So this is if you want, but last at the end, after the formation of the clot also, we request factor number 13, that is for the stabilization of the clot. Sometimes everything is normal, intrinsic pathway is normal, extrinsic pathway is normal, but still the patient is bleeding. That condition may be because of factor number 13 deficiency. Okay, where the stability of the clot is not there, so therefore clot often get disintegrated and bleeding continue. That is also one of the possibility. I hope now it is very clear. Now, what we understood so far we understood that irrespective of the pathway, what we are getting at the end is fibrinogen. Fibrinogen is a plasma soluble protein. That particular fibrinogen we are getting, and that fibrinogen is converted into fibrin, which is plasma insoluble protein. We want an insoluble protein. We want to block that broken area. Okay. So what is the role of the fibrinogen? The role of the fibrinogen is forming the permanent hemostatic plaque. But apart from that, fibrinogen has got some other roles also. Fibrinogen is also required for the process of the opsonization. Opsonization means it is one of the process in phagocytosis. So when there is infection, opsonization will take place, and that also requires the fibrinogen. So fibrinogen is not only limited to the coagulation pathway. Then thrombin in between, prothrombin is converted to thrombin. Thrombin is converting fibrinogen into fibrin, isn't it? So this thrombin is also, apart from its clotting game, it also has got one more important function. It is also required for the chemotaxis. Chemotaxis during the time of the infections. Now, any problem in activation of the clotting factor in between. Okay. Suppose if there is any problem, now come to the point. We have got factor number 1 to 12. If there is some deficiency of this or absence of this clotting factor starting from 1 to 13, then this whole process of formation of the fibrin, okay, from the prothrombin, so that will not take place, because for the formation of the prothrombin conversion into thrombin, that requires the clotting factors, factor number 10. Okay, but factor number is 10 will be going to activate only if the factor number 9 activates. Factor number 9 if factor number 8 activates. So like this the change will be there. So okay, so chain continues. So now suppose if there is any problem in activation of the clotting factor, any clotting factor from 12, 11, 10, 9, 8, any clotting factor in between, it will take more time to convert the fibrinogen into fibrin naturally. Okay, so it will, that particular phase will be get disturbed. It is not produced, the fibrin is not produced in that phase. Suppose intrinsic pathway one clotting factor is absent or deficient, then less prothrombin will be formed. Okay, less prothrombin will be formed, but extrinsic pathway is working, so that is forming the prothrombin. Okay, yes, prothrombin is formed, bleeding is also arrested, but not up to that mark. The phase is that formation of the fibrin. Okay, that phase of speed will be coming down. So any problem in activation of the clotting factor in between will take more time to convert the fibrinogen into fibrin. So person who has started with the bleeding, so he will be now bleeding for a long time, because it takes a long time to produce a permanent plug. अगर दोनों पाथवे से अगर आपको मिल रहा है थ्रोम्बिन और दोनों मिल के कर रहा है तो वो जल्दी हो जाएगा. नहीं, यहाँ पे एक पाथवे इंट्रिंसिक पाथवे ब्लॉक है, ठीक है, तो एक्सटेंसिव पाथवे के ऊपर आप डिपेंड है, तो वो जो कितना प्रोड्यूस करेगा उतना ही है ना, तो ब्लीडिंग में कंटिन्यू. सो देयर विल बी एक्स्ट्रा ब्लीडिंग, और देयर इज फेलियर टू स्टॉप द ब्लीडिंग कंप्लीटली, बार बार इट इज गेटिंग ओपन अप, और देयर में बी रिकरेंट ब्लीडिंग आफ्टर माइल्ड ट्रोमा हो रहा है, तो उसके बाद भी जो है रिकरेंट उसको ब्लीडिंग चल रहा है, और देयर इज ए प्रोलॉन्ग्ड टाइम टू स्टॉप द ब्लीडिंग. ब्लीडिंग टाइम में बी प्रोलॉन्ग्ड, क्लॉटिंग टाइम में बी prolonged. So such disorders where intrinsic pathway is get affected, factor number 12, factor number 11, factor number 9, factor number 8, Willebrand's factor, factor number 9, and factor number 10. So when these are get affected, we call it as intrinsic pathway, and this type of intrinsic pathway is get affected and leading to the less formation of the prothrombin. This is very commonly seen in case of hemophilias. Hereditarily, there will be absence of some of the clotting factors. Okay, factor number 8 and factor number 9 especially. Okay, hemophilia A, hemophilia B, hemophilia C is there. Hemophilia, that is factor number 8, is called as true hemophilia or classical hemophilia. Okay, so such disorders are referred as hemophilic disorders, hereditary disorders. Okay, so more commonly it is an X-linked type of disorders, X-linked recessive type of disorders. So anyway, we will discuss that also. Hemophilia A is 8, factor number 8 deficiency, hemophilia B is factor number 9 deficiency, and hemophilia C is factor number 11 deficiency.
Excuse me, sir.
Now, how to identify the defects? How to identify the defects? Now we have to go for two tests. One is prothrombin time. That is, prothrombin time is for the extrinsic pathway, and APTT, that is activated partial prothrombin time for intrinsic pathway. This already we have covered, and this is also done by using a platelet free plasma. in the room temperature within 2 hours after the sample collection. Okay. Now for prothrombin time, we have to add tissue thromboplastin, and for the APTT we have to add choline or silica. Now test tube which is used is a plastic tubes or syringes. Why we are not using any glass tube? The reason is very simple, because they have got negatively charged ions. So when we put plasma, it maybe artificially activates the pathway. Okay. So when we talk about the two parameters, PT, that is extrinsic, and APTT, that is intrinsic pathway. Now how to use this particular knowledge in case of clinical scenario? Okay, in the clinical scenario usually we will conduct both the tests together, and then we will interpret the results. So the rest of the things related to the clinical significance of this intrinsic and extrinsic pathway, so that we will discuss in the next class. Thank you very much.